as you all know, hypomagnesemia tetani or hypomagnesemia is also a kind of metabolic disorder which occurs in those animals which have been kept in the forest, abundant area, okay, where there is a greater ability of देखो भाई किसी का ही है कुमार निर्मल म्यूट करो हेलो so there are several names of this particular disease
Slide is not visible.
and those are hypomagnesic tetani, grass tetani, grass staggers, lactation tetani. As far as definition is concerned, so you may define it by or hypomagnesemia tetani is a complex metabolic disorder characterized by hypomagnesemia and reduced concentration of magnesium in the CSF plasma, which lead to hyperexcitability, muscular spasms, convulsions, respiratory distress, collapse, and death. So these are the important terminology which comes in the definition of hypomagnesemia tetani, and I think everybody is well aware of the terminology which has been incorporated in the definition of this particular disease. So most important thing of hypomagnesemia tetani is the hyperexcitability, muscular spasm, convulsive episode.
सर स्क्रीन शेयर नहीं हो रहा सर हेलो
स्क्रीन शेयर नहीं हो रहा
नो सर
स्क्रीन तो शेयर्ड है भाई आ रहा है दिख रहा है
नहीं सर लिख रहा है सर शेयरिंग
शेयरिंग स्क्रीन नहीं दिख रहा है
नो सर
I think now it is visible.
Yes, sir.
Is it visible now?
Yes, sir.
As name itself is explanatory, what is the etiology of this particular disease? So name itself is explanatory. By simply knowing the name of this disease, one can say that this is hypo condition. That means there is a deficiency. There is a less concentration of that particular element or minerals in the plasma or other fluid, body fluids, which leads to the production of characteristic clinical signs. So, as far as susceptibility is concerned, adult lactating animals are most susceptible, and those which are kept on the lush green pastures or lush green fodders, it's supposed to be again having predisposing factor and which makes the animal more susceptible. It is rare in non-lactating cattle, but may occur when undernourished cattle are introduced to green cereal crops and occurs due to decrease in plasma magnesium concentration. And as you know, everybody might be knowing, you must have taught in nutrition. For maintenance, the magnesium concentration is required 3 mg per kg body weight daily in 24 hours. And if the animal is in production stage, 120 mg per kg of milk production, additional magnesium is required. So whenever there is a large quantity of milk is produced by the animal, so additional magnesium should be incorporated in the diet to prevent or to save the animal from the hypomagnesemia tetani or hypomagnesemia. As you know, magnesium absorption is depends upon several factors, which is guided by the renal. If there will be more potassium and nitrogen uh, intake, then what will happen? The magnesium absorption from the renal valve will decrease, and if the sodium potassium intakes are low, then again the magnesium absorption will decrease. So it is contradictory. Potassium and nitrogen availability reduces the magnesium absorption, and deficiency of sodium and phosphorus reduces the magnesium absorption from the renal. So this is to be kept in mind. Which minerals or which element reduces the absorption or which increases the absorption from the renal. But simply hypomagnesemia doesn't produce clinical manifestation until the blood calcium concentrations are less than 0.8 milligram per deciliter. Sorry, blood magnesium concentration reduces to 0.8 milligram per deciliter. It commonly occurs in cattle grazing green crops or green cereal crops or green pastures. Lush green pasture and green cereal crops may predispose cattle to metabolic acidosis, alkalosis. Sorry. And as you know, the metabolic alkalosis reduces the availability of ionized calcium and magnesium, thereby increasing the risk of hypertension and hyperglycemia. I told you in the milk fever treatment, there should be acidic condition so that the mobilization of calcium from the store can be take place easily. But due to grazing on green pasture, the animals suffer from metabolic alkalosis, and this definitely reduces the calcium or magnesium or availability in the plant, mobilization from the store. And there is no any feedback mechanism involved in the maintenance of magnesium, normal magnesium level in the plasma. But calcium level is maintained through the feedback mechanism. So here, this is a very peculiar point. As in case of calcium deficiency, the calcium may be mobilized from the store under the influence of hormonal control, but magnesium is not mobilized from anywhere else, and this is not under the control of hormonal mechanism of hormonal stimulation. Immune magnesium concerns are useful guide to magnesium status and are undetectable in power hypomagnesemia. Next one is the clinical signs. So most important form is the acute form. When the animal is suffer from the acute form, what will happen? The cow suddenly throw up their heads, bellowing, starts bellowing, gallop in a blind frenzy manner, falling sudden fall, and exhibit severe paddling convulsion. So these are the important clinical manifestations, and almost all the signs which have been mentioned here is related to the nervous system. So stargazing appearance will be there, continuous bellowing there will be there, galloping in blind frenzy manner, sudden falling down, and exhibit severe paddling convulsion. These are the important clinical manifestations. Convulsive episode may be repeated at short intervals, and death usually occurs within a few hours. In many instances, what happens, animals at pastures are found dead without observed illness. So, in those animals, when you are doing you will go to perform the postmortem examination, you should inspect the area. If the animal had died due to hypomagnesemia, there must be bruise mark on the head because of convulsive episode. There will be uh, wound or breakage of jaw. There will be excavation of soils in those areas due to convulsive episodes. So we can say that we can decide or we can come to the conclusion animal is had suffering from the hypomagnesemia and animal died due to that particular thing. But in less severe case or in subacute case, the cow is obviously ill at ease, walks stiffly, stiff walking behavior, and there will be hypersensitivity and frequent urination may progress to acute convulsive stage after a period of 2 to 3 days. With hypomagnesemia, tachycardia and loud heart sounds are characteristic signs. So, if there will be hypomagnesemia, tachycardia and loud heart sound will be heard. Diagnosis. So, main way of diagnosis is through the response to treatment. If you will treat for hypomagnesemia, and animal is responding favorably, then you can see that this is a case of hypomagnesemia. And by measuring the magnesium level in the plasma, if there will be less than 1.2 milligram, this is of diagnostic importance. The animal is hypomagnesemia. And if there will be less than 1.2, but this is sick. Urine magnesium is usually undetectable in cows with hypomagnesemia. Magnesium concentration less than 1.8 milligram per deciliter in the vitreous humor of the eye. So, vitreous humor concentration should also be measured if the animal is suffering from hypomagnesemia and died due to that. So, during the postmortem, we can take the vitreous humor and measure the concentration. Now come to treatment. So, if there is a combined deficiency of calcium and magnesium, so nitrates should be taken. If there are a lot of preparation available in market, so nitrates should be given on the treatment, or calcium and magnesium salt should be given slow high. The response to treatment is slower in animals with hypomagnesemia than in animals with hypocalcemia alone, because of the time it takes to restore magnesium in the CSF. Okay, so this is very important. The response to treatment will be slower in hypomagnesemia than in the hypocalcemia alone. Because of there should be a normal concentration of magnesium in CSF, and it takes time. That's why because of the time it takes to restore magnesium in CSF. Additional magnesium sulfate 200 milliliter of 50% solution per cow can be given subcutaneously. Animal must be provided with hay treated with 2 ounces of magnesium oxide daily. If this is not done, the condition can take 6 hours after initial. Even we will treat the cases and left the animal without supplementation with magnesium oxide. It's very so it is always advisable to provide the animal A treated with magnesium oxide. Daily magnesium oxide to cattle and 60 gram and 10 gram to sheep should be given in tandem. animal may suffer from the disease, then as a preventive measure, daily magnesium oxide should be given. In developed countries, they use intravenous magnesium devices to prevent the occurrence of hypomagnesemia. Fertilizers containing magnesium effectively increases surface magnesium, and it should be uh, used to increase the magnesium concentration of bodies, which may be tested with powder and or sprayed with 2% of magnesium sulfate. But to do it, you increase the concentration of magnesium or grasses. So this is all about the hypomagnesemic tetany. Now come to the another disease. I think it is visible to you, fat cow syndrome or pregnancy toxemia of cattle. Is it visible?
No, sir.
No, sir.
नहीं दिख रहा है?
No, sir.
Is it visible now?
Yes, sir.
दिख रहा है ना?
Yes.
Hello. Fat cow syndrome or pregnancy toxemia of cattle. Pregnancy toxemia of sheep and pregnancy toxemia of cattle is totally two different things. Don't get confused with each other. Okay. In last class we have discussed about the pregnancy toxemia in sheep. Here, pregnancy toxemia in cattle. Right. Another name is fat cow syndrome. This is a common periparturient disorder in cattle. And periparturient disorder usually develops before and during parturition. And it usually occurs due to endocrinological changes associated with parturition and lactogenesis, which favors the development of fatty liver. Coming slide, we'll discuss how the fatty liver affects or how the fatty liver occurs in the high producing animal. And it is often first noticed when seen standing amongst other dry cows. Then differentiate the cow which is suffering from syndrome. Then it will be standing among the other dry cows. Next, as far as etiology is concerned, this is caused by the excessive consumption of unbalanced diets. That means if there is a need of energy, those circumstances will giving the animal the ration which is having high protein content. What will happen? There will be imbalance of nutrients. So animal will suffer from the disorder like fatty. Progression of the disease occurs in obese cattle before and during fat consumption. And this is, I told you in the beginning, this is associated with endocrinological changes that occur after calving with the onset of the production of milk due to lactogenesis. And every cattle or every animal which start lactating obviously suffer from the anorexia. And once the anorexia will develop, what will happen? There will be mobilization of the stored fat from the adipose tissue and skeletal muscles, and it will be converted into non-esterified fatty acid in the plasma and fatty liver. And non-esterified fatty acid should be used for the production of gluconeogenesis gluconeogenesis for the production of glucose through the gluconeogenesis, but due to deficiency of yellow acetate, there all the NEPA will not be utilized for this, then additional NEPA will be deposited in the hepatocytes and fatty liver cells will be developed. So, if the concentration of 1000 micro equivalent per liter is deposited in the hepatocytes, then we can see that we can say that the animal is suffering from fatty liver syndrome. Now come to the diagnosis. Sorry. NEPA in liver. How the NEPA in liver acts. What is the fate of NEPA in liver? If there will be a proper oxidation of NEPA in liver, it will produce the carbon dioxide and acetoacetate and PHP. If there will be adequate quantum of oxaloacetate in the cells, then this ketone body will be utilized for the post sugar gluconeogenesis. In case of absence of gluconeogenesis, propionic acid or other things that deposited as a fat in the hepatocytes. Esterification will produce the triglycerides. Clinical signs. The syndrome has no clinical signs, but one distinctively indicates as an overnight fat count. Inappetence, depression, and lowered milk production will be there. Loss of body temperature, sickness, nervousness, reduction in body temperature, reduced fertility, and poor productive performance. Greater incidence of milk fever, pitosis, clinical mastitis. These are the complications of fatty cow syndrome. Blood test results that show elevated level of NEPA. This ketone body in the blood. Diagnosis based upon the following facts. Then is the outbreak in fatty animal. If the fatty animal state, then we consider the animal is suffering. Maybe suffering from liver biopsy, most reliable test, total lipid or triglyceride measurement, blood glucose, blood ketone body, steam, LG, diagnostic. 8. Through these parameters, we can diagnose the fatty liver. And as far as treatment is concerned, no proven treatment for this particular disease has been defined so far. So, effective treatment is to expose lipoprotein and lipoglycerides from the liver. So, for that, we need to use choline and acetone with minimal vitamin. And these are also oftenly coming in the combined state. A lot of precautions are available in injectable form. Can use for the treatment. Vitamin and mineral supplement to fulfill nutrition requirements for protein and energy. And no high calcium grain mixture. So these things. And in case of high negative energy balance, glucose and electrolyte solution may be given. Luminal juice may be given 5 to 10 liters, corticosteroid or hormone therapy at the insulin has been choline chloride at the 25 gram, subcut may be given, anabolic steroid may be given. As far as prevention is concerned, so don't allow the cow in dry period to be overfed. Okay, so balanced diet should be given to reduce the fat deposit rapid diet change should be avoided. Unpalatable feedstuff should not be given. And stress and minimizing change with stress, so less environmental stress should be exposed to the animal. Okay, and glucose or its precursor supplement maybe given to reduce the
सर आवाज नहीं आ रहा है सर। हेलो
Hello.
सर, आवाज प्रॉपर नहीं आ पा रहा है सर।
अभी तक आ रहा था, बंद हो गया ना?
नहीं सर, प्रॉब्लम तो शुरू से ही है सर। कभी कभी ठीक है, कभी कभी बीच में कम हो जा रहा था आवाज।
पूरा सिस्टम से हम क्लास ले रहे हैं आज तो भाई, कोई कंप्लेन नहीं है। नहीं, अभी भी नहीं जा रही आवाज। हेलो,
अभी ठीक है सर, फिर बीच बीच में सर ना कम हो जा रहा है आवाज। ऐसे बोलते हैं ना तो फिर बीच में कम हो जाता है।
जब कमेगा तो बताना। अभी ठीक है ना?
यस सर, अभी ठीक।
So this is all about the fatty cow syndrome. Now, next disease will be Osteodystrophy Fibrosis, or another name of this disease is the brand disease. I'm sharing the slide. Is it visible?
No, sir.
Now it is visible. Hello.
Yes, sir. Yes, sir.
आवाज जा रही है?
Yes, sir.
So let us start osteodystrophy fibrosis. Okay. So as you all know, or you all are aware, this is a particular disease of the stall fed animal. Those who are being fed at the house or home or at the bar is used to suffer from this disease mostly. Okay, that's why name has been given as a brand disease, big head disease, or Miller's disease. Why Miller's disease? Because of the persons, those who are involved in the milling business or milling occupation, they used to feed their animal excessive bran, and bran is supposed to be having rich concentration of phosphorus. And when there will be imbalance of phosphorus and calcium, there will be mobilization of calcium from the store, and the bone will be converted into fibrous tissue. That's why the bone will appear pulpy and the density of bone decreases, which makes the bones to the prone to the fracture. So, principal cause of dystrophy are deficiency of or imbalance of calcium, phosphorus, and vitamin. It may be absolute or relative. Deficiency may be absolute or relative. Absorption from the gut depends on the availability of vitamin D. Everybody is Hello. Hello. So vitamin
Yes,
D
sir.
should be available for the proper absorption of calcium and phosphorus from the gut. And in case of deficiency of calcium in the plasma, PTH is released, and PTH increases the calcium in blood flow, and it will act upon the kidney to release a hormone that 125 dihydroxycholecalciferol. And it will also help in the more and more absorption of calcium from and phosphorus from the gut. So this it occurs in horse, goat, and swine due to secondary calcium deficiency in presence of high phosphorus diet. And in this particular disease, the ratio of calcium and phosphorus is between 2 to 1 to 2.9, and more favors the disease. Cereals and its say or bran feeding produces disease. As I told you, bran is the most important cause of disease. Hypogenesis is well known to everybody. Excess phosphorus will lead to the production of PTH release, and PTH release will lead to the calcium resorption from the bone. If the calcium is mobilized from the bone, it's fibrosed and thickness of bone upon separation of muscles and tendons from the bone is the ultimate outcome. Clinical finding well known to everyone: lameness, arching back, facial swelling, anorexia, sprain of tendons, fracture, swelling of alveolar margin of mandible, followed by soft symmetrical enlargement of facial bone, flattening of ribs, and anemia in final stage. Flattening. So these are the important clinical manifestations of the osteodystrophy fibrosis. What happens? Diagnosis and treatment. There will be increase in phosphorus concentration in blood and alkaline phosphatase as well. Decrease in calcium. And if you take the X-ray of the affected part, translucent radiogram or more thickened appearance will be there. And treatment, as far as treatment is concerned, correction of imbalance of calcium and phosphorus, that is 1:1 should be the ratio, or maximum 1:1.4. Legume A should be given to decrease the phosphorus content, and limestone feeding should be regularly fed to the animal at the rate of 30 grams per acre. These are the important indications about it. And if this particular disease occurs in the adult, or you can say this is adult rickets, characterized by formation of excessive unmineralized iron trabecular surface. Signs are untrippiness, pica, septic lameness, lordosis, kyphosis, magnesemia. So this is the osteomalacia of adult rickets. This is all about osteodystrophy fibrosa. Now come to peripheral hypocalcemia. क्लैम्पसिया दिख रहा है स्क्रीन पे?
नो सर,
दिख रहा है?
नहीं दिख रहा है सर।
दिख रहा है। अब दिखा? हेलो?
यस सर।
Eclampsia. So this is the important disease of bitch, especially pregnant bitches are suffer from this particular disease, and it occurs due to multiple fetus present during the gravid condition, which makes the animal highly negative in terms of energy content of the diet and presence of glucose in the body, or hypoglycemia is the condition. Okay, so there are several synonyms of this disease is also puerperal hypocalcemia, periparturient hypocalcemia, puerperal tetany. So these are the synonyms of the disease. Next. And as far as definition is concerned, this is a metabolic disease of lactating and pregnant bitches, clinically characterized by sudden onset of weakness, tremor, collapse, or seizures that is caused by hypocalcemia. Okay, it is acute life-threatening condition that usually occurs 2 to 4 weeks after helping. Small bitches with large litter size are more prone to develop this particular disease. Okay, and as far as pathophysiology is concerned, it involves release of acetylcholine during neuromuscular transmission. transmission. As you all know, calcium is required for the release of acetylcholine. And muscle contraction stabilizes nerve cell membrane by decreasing permeability of sodium. During hypocalcemia, nervous system becomes more excitable due to increased neural the nerve fiber discharges spontaneous impulse to skeletal muscles. Here they receive tetanic contraction. This is the reason why the tetanic contraction is the main clinical manifestation. So as far as clinical manifestations, panting and restlessness in the pregnant bitches or bitches help recently. Tremors, twitching, tetany, muscle scar, and gait changes, stiffness of ataxia occurs due to increased neuromuscular excitability. And due to excessive neuromuscular excitability, there may be hyperthermia, severe pain, and may aggravate clonic muscle scar, fever, tachycardia, meiosis, seizure, and death of the enemy. And as far as diagnosis is concerned, history, clinical signs, estimation of serum calcium level is a very important diagnostic aid. As far as the treatment of this particular disease is concerned, 10% calcium gluconate at the dose rate of 0.5 to 1.5 milligram per kg body weight is recommended, और 5 to 15 मिलीग्राम दोनों डोज रेट याद रखना है. अगर ईमेल में पूछा है तो 0.5 to 1.5 ml per kg body weight, और if it has been asked in milligram, 5 to 15 milligram per kg body weight. And the clinical recovery should be within 15 minutes. Vitamin D supplementation is also indicated, which increases the calcium absorption from the gut at the low rate of dihydropolyculture pheromone is also given and during administration of calcium, heart rate should be carefully to omit the bradycardia or calcium. This is all about all the four diseases left to the now. This is the last class of metabolic disorder. Meet in next unit or next class only. Okay. Thank you. विकास गुप्ता, विकास कुमार गुप्ता, हेलो, सुन रहे हो? हेलो, विकास.